Gentlemen, imagine tomorrow morning, you reach up for a shirt, turn the steering wheel, or lift a bag from the kitchen counter, and your shoulder reminds you again. Not with a small warning, but with that same sharp catch, that same weakness, that same hesitation that makes you stop halfway and think, what exactly is wrong with this shoulder? And maybe you have already tried the obvious things. You have stretched it. You have rolled it. You have rested it for a few days. Maybe you even searched for exercises online and tried a few at random. But instead of settling down, the shoulder still feels irritated. Or worse, more confused than before. Now here is the problem. Shoulder pain is not one single problem. Different structures in the shoulder can become irritated in different ways. One type of pain may calm down with gentle movement. Another may feel worse if you stretch the wrong area too aggressively. One man feels a painful pinch when lifting the arm. Another feels weakness the moment he tries to hold it up. Someone else notices the pain mainly when turning the arm outward, steering, or pulling something open. So if you treat every shoulder pain the same way, you can easily waste time, and sometimes make it worse. But there is good news. There are simple ways to narrow down the pattern you are dealing with. And there are safe starting steps that may help you reduce irritation, restore control, and rebuild strength gradually. In this video, I'll walk you through a simple shoulder approach you can follow at home. First, I'll help you understand why shoulder pain behaves so differently. Then I'll show you the 3 main patterns many men experience. And finally, I'll give you a practical step-by-step routine you can start using over the next 7 to 14 days. No miracle pramisis. No extreme stretches. No, just push through it. Just a calmer, smarter way to begin. Now let's start with the why. The shoulder is one of the most mobile joints in the body. That sounds like a good thing until you realize that mobility comes with a price. The shoulder depends heavily on timing, control, and muscle coordination. If one part is irritated, weak, or not moving well, the whole system starts to complain. Think of your shoulder like a moving crane mounted on a small base. It can reach in many directions, but only if the support cables, hinges, and platform all work together. If one cable is tight, one hinge is inflamed, or the base is unstable, the movement becomes rough, strained, and painful. There are 3 simple reasons this often happens. First, space becomes limited. When you lift your arm, there is a narrow area in the shoulder where tendons and soft tissues pass through. If the mechanics are off, that space can feel crowded. The result is a pinch, catch, or painful arc during lifting. Second, the rotator cuff may lose strength or tolerance. These are small but important muscles that help keep the shoulder centered and controlled. If one becomes irritated or weak, the shoulder may feel shaky, painful, or unexpectedly heavy during everyday tasks. Third, the shoulder blade may not be doing its job well. This is where most men get it wrong. They focus only on the arm, but the shoulder blade is part of the system. If it stays stiff, shrugged, or poorly positioned, the shoulder loses support. It is like trying to move a crane smoothly on a crooked base. So when you feel shoulder pain, weakness, or stiffness, you are often dealing with some combination of these 3 issues. Reduced space, reduced cuff support, and reduced shoulder blade control. Now here's the key. Before you jump into random exercises, it helps to identify which pattern sounds most like your real-life pain. Here are the 3 common patterns. Pattern 1, the lifting pinch. This is the man who says, "It hurts when I lift my arm out to the side, especially through the middle." Often the arm starts out fine. Then around the mid-range there is a pinch, catch, or sharp ache. Sometimes if he continues lifting higher, the pain eases again. That pattern matters. It suggests the shoulder may be getting irritated during that middle part of the lift, especially when space and shoulder blade mechanics are not working well together. Pattern 2, the weak and painful hold. This is the man who can raise the arm, but when he tries to hold it there, resist a little pressure, or do overhead tasks, the arm feels weak, sore, or unreliable. Not just stiff. Weak. This often points more toward a rotator cuff overload pattern, especially in the muscles that help start the lift and keep the shoulder steady. Pattern 3, the outward turn problem. This is the man who notices pain when steering, reaching back for a seat belt, putting on a jacket sleeve, or turning the forearm outward with the elbow tucked. This pattern often shows up when the outward rotator muscles have been neglected for years. Daily life tends to pull the shoulders inward, desk work, driving, typing, phone use, stress posture. Over time, The muscles that should control outward rotation may become weaker and more irritable. Now, some men will hear this and think, that sounds like all three. That is common. You do not need a perfect label. You only need to ask one useful question. Which pattern feels most like the pain you deal with in daily life? That is where you start. So let's build the routine. I call this the 4-step shoulder reset. Step 1. Calm the shoulder down. Step 2. Restore supported motion. Step 3. Rebuild shoulder blade control. Step 4. Add safe strength. Let's go through each one. Step 1. Calm the shoulder down. If your shoulder is already irritated, aggressive stretching is not always the answer. Start with gentle, unloaded movement. Lean forward slightly with your good hand supported on a table or chair. Let the sore arm hang relaxed. Then use your body to create very small swings, forward and back, side to side, and tiny circles. About 20 to 30 seconds each direction is enough. The arm should feel heavy and relaxed, not active and tense. Why does this help? Because it gives the joint gentle motion without asking the irritated tissues to lift or fight gravity. Think of it like loosening a stuck door hinge without forcing the door open. If this makes the shoulder feel calmer, lighter, or less compressed, that is a good sign. Step 2. Restore supported motion. Now we begin to reintroduce range. But with help. Sit at a table and place your forearm on a towel. Slowly slide the arm forward across the table. Go only until you feel a gentle stretch or mild effort. Then return slowly. 8 to 10 smooth repetitions is enough. The table is doing some of the work here. That matters. Because when the surface supports the arm, the shoulder can explore motion with less strain. This is often much safer than forcing unsupported overhead movements too early. Now here's the transition most men miss. If you only move the arm and never improve the support system behind it, the pain often comes back. That brings us to step 3. Step 3. Rebuild shoulder blade control. Sit or stand tall. Let the neck stay relaxed. Then gently draw the shoulder blades slightly back and slightly down, not in a stiff military posture, just enough to feel the mid-back wake up. Hold for about 5 seconds. Then relax. Repeat 8 to 10 times. This looks simple, but there is more going on than most people realize. The shoulder blade helps create the platform the arm moves from. If that platform is unstable, shrugged, or late to respond, the shoulder can feel crowded and clumsy. Better blade control may improve comfort during lifting and reduce that pinch zone feeling over time. Think of it like straightening the rails before asking a sliding door to move smoothly. Now step 4. Add safe strength. This is where patience matters. If your shoulder has been sore for weeks, jumping into heavy strengthening too quickly can flare it up. Start with isometrics first. That means the muscle works, but the joint barely moves. If your pain shows up more when lifting the arm out to the side, stand with your sore side near a wall, elbow bent, and gently press the outside of your arm into the wall, as if trying to lift outward. Hold 8 to 10 seconds. Light pressure only. Around 30 effort is enough at the start. If your pain shows up more with outward turning, bend the elbow to 90 degrees, keep it tucked to your side, and gently press the back of the wrist outward into a wall without letting the arm move. Again, hold 8 to 10 seconds. Light effort. 5 repetitions. This kind of work may help the rotator cuff rebuild tolerance without provoking too much irritation. After several days, if pain is not increasing, you may slowly progress the effort. Not all at once. Not with ego. Gradually. Now let's talk about the most common mistakes. Mistake number 1. Stretching into sharp pain. A mild stretch or light effort may be acceptable. Sharp pain, catching, or pain that lingers and worsens afterward is a warning sign. More discomfort does not automatically mean more progress. Mistake number 2. Doing too much too soon. This is especially common in men who are used to pushing through things. They feel one good day and suddenly return to heavy presses, hard band work, or repeated overhead motion. Then the shoulder flares again. Recovery usually responds better to consistency than intensity. Mistake number 3. Ignoring weakness. Some men focus only on flexibility. But if the shoulder feels weak, shaky, or poorly controlled, mobility alone is not enough. The support system has to improve too. Mistake number 4. Forgetting the shoulder blade. If your posture stays collapsed, your upper back stays stiff, and your shoulder blade never learns to move better, the shoulder often stays irritated. Mistake number 5. Using pain as the only guide. Some men stop all movement the moment they feel anything. Others ignore every signal and push through everything. Neither extreme is helpful. What you want is controlled, tolerable work that does not leave the shoulder clearly worse later that day or the next morning. Now let's build the lifestyle support stack. Because rehab does not happen in isolation. First, sleep. Sleep is the body's repair mode. Poor sleep increases pain sensitivity, reduces recovery, and makes muscles less resilient. If you snore heavily, wake unrefreshed, or suspect sleep apnea, that matters too. Shoulder pain recovery is harder when sleep quality is poor. Second, daily movement. You do not need intense workouts, but you do need circulation. Gentle walking, light posture breaks, and not sitting in one position for hours can help reduce stiffness and improve tissue tolerance. Third, hydration. No, water is not a cure, but dehydration can make tissues feel less forgiving, especially when combined with poor sleep and long hours of sitting. Fourth, food quality. Think of recovery like building materials. Your body needs protein, micronutrients, and steady blood sugar support. If you are dealing with diabetes, high cholesterol, excess weight, or high blood pressure, these factors can influence healing and inflammation over time. Fifth, stress control. Stress changes posture, breathing, muscle tension, and even how strongly you perceive pain. Tight shoulders and shallow breathing often travel together. 5 minutes of calm breathing, a short walk, or reducing constant tension during the day may help more than you think. Now we need to cover safety. Please do not self-diagnose serious shoulder problems from a video. These general strategies may help common mechanical shoulder pain, but some situations need medical attention. Speak to a doctor or physical therapist if your pain started after a fall, a sudden lifting injury, or trauma. Get evaluated if the shoulder feels unstable, like it may slip out. Be cautious if you cannot lift the arm at all, if weakness is getting worse, or if you have severe night pain that wakes you regularly and does not settle with position changes. Seek medical care sooner if you have numbness, tingling down the arm, chest symptoms, fever, redness, unusual swelling, unexplained weight loss, or pain that seems unrelated to shoulder movement. And if you have diabetes, significant blood pressure issues, a history of major shoulder injury, or symptoms that are not improving after a few weeks of doing the right things, professional evaluation is a smart next step. Now here's your 14-day challenge. Days 1 through 4. Do the pendulum-style relaxed motion once or twice a day. Add supported table slides for 8 to 10 reps. Finish with 8 to 10 shoulder blade squeezes. If tolerated, add 3 to 5 gentle isometric holds for your main pain pattern. Days 5 through 9, keep the same routine. If pain is stable or slightly improved, increase the quality of the movement, not the aggression. Cleaner reps, better posture, more controlled breathing. You may increase isometric effort slightly, but stay well below sharp pain. Days 10 through 14. Retest your most common movement. Does lifting feel smoother? Does the arm feel less weak? Is steering, reaching, or dressing a little easier? Even small improvements count. That is how good rehab often begins. Not with a miracle, but with a noticeable change in confidence, comfort, and control. And during these 14 days, keep the basics strong. Sleep better if you can, walk daily, eat like recovery matters, hydrate, and stop treating pain like a personal challenge you have to defeat in one session. Now let me leave you with this. Your shoulder does not usually need panic. It needs a plan. It needs patience. It needs the right amount of movement, the right kind of strength, and enough consistency for the body to adapt. That is how you rebuild trust in the joint. Not by forcing it, by guiding it. So start with the pattern that sounds most like your real-life pain. Use the routine calmly. Stay consistent for the next 7 to 14 days. And watch for progress in the movements that matter to your daily life. Because control comes back before confidence does. And confidence comes back before full strength. Keep going in that order. If this kind of practical, clean men's health guidance helps you, subscribe to Dr. Emma Mitchell for more evidence-based videos designed to help you move better, age stronger, and stay independent. Take care of your shoulder. and I'll see you in the next video.